Hello everybody, today we're doing a talk on iron deficiency anemia.
We have a clinical case, and then we find a 35-year-old woman that complains of fatigue. She's tired all the time, shortness of breath, and also dizziness.
So she says she craves chewing on ice cubes, and when you look at her, she has mucous membranes of her mouth that are pale.
She also has tachycardia. Now, what should we look for when going through the medical history? We go for the symptoms of anemia, pica and restless leg syndrome. Now, also the ones that we mentioned before, fatigue, dizziness, shortness of breath. Now, the conditions, we need to think about the conditions that could interfere with iron absorption, like celiac disease. You also think about potential sources of blood loss, maybe a tumor, and you think about gynecological problems as well. Now, the last one is you think about the diet. Maybe the patient is not ingesting the right amount.
Now, during the physical exam, what should we look for?
We usually look for paleness in general in a specific areas, such as the lower inner eyelid or the nails. Maybe a sign of moderate or severe iron deficiency anemia.
Now, so we order a CBC, a complete blood count, and what does can it show?
Okay, if you notice, the cells are small and they are pale. Also, we can find low red blood cell count, low reticulocyte count, and at times high platelet count. It depends on the cause of it.
Okay, so anemia, low RBC count, and microcytic. If we suspect iron deficiency anemia, what additional blood work should we order?
Okay, it is important to order iron, transferrin, ferritin, okay, because it is sensitive and specific for iron deficiency anemia. Also, the percent transferrin saturation, which is calculated by dividing iron by total iron binding capacity and multiplying it by 100.
Perfect. Now, why is TIBC so important?
It is important because it is high in iron deficiency anemia. It is low in anemia of chronic diseases. Both illnesses have decreased serum iron levels, but that can help us differentiate between one and the other one.
So remember, if ferritin is normal, but transferrin saturation is less than 0.12, think iron deficiency, okay? And anemia chronic disease often has a normal iron to TIBC ratio. Now, you finally diagnose this patient with iron deficiency anemia. What other conditions is the patient at risk for developing?
Okay, you think about Plummer-Vinson syndrome. If you see the picture in the smear, you can see the hypochromic and microcytic anemia, red blood cells, then you see the atrophic glossitis, and then you see the esophageal web.
Yeah. So patients with extreme cases of iron deficiency are at risk for what's called Plummer-Vinson syndrome, atrophic glossitis, esophageal webs, and anemia. And that's a good picture of the glossitis right there, and the web and the hypochromic microcytic anemia. So thank you very much for watching our video, and if you'd like to continue seeing videos such as this, please subscribe, like, add comments, and in the comment section, if you have any special topics you would like us to include or discuss, please let us know. Let us know which format you like better. Do you like it with commentary, no commentary, just a voiceover? Your comments are very much appreciated. And
Thank you.
Thank you very much for watching.